revolutionize artificial intelligence. How many of you recognize the name Daniel Pearl? This is good. Judea Pearl is his father. Daniel Pearl, for those of you who don't know, was decapitated by terrorists in the Middle East. But you must read this book. We're talking about the Harper fragment tonight. We've lost control here. There we go. The material I'm talking about tonight is covered quite thoroughly and in great detail in my ebook on Amazon. Billy Harper marked this map. I'm sure you all know who Billy Harper is. He discovered this bone fragment in Dealey Plaza, and I hope you're oriented here. This is Elm Street. This is Houston Street, so the limousine made the very acute turn here, came down Elm Street. Millicent Craner sent this map in about 1996 to Billy Harper, and he placed the site of discovery here. Tim Nicholson calculated the distance from 313 to the discovery site as 117 feet, which means that if this is really where it landed, which I doubt, it meant that the bone fragment traveled against a wind of 15 to 20 miles per hour, left the right side of JFK's head, and traveled to the left, none of which makes any sense. I added this in the Warren Commission data tables. The fatal shot is here. That's discussed extensively in my ebook. Why is this important? If the fragment derives from the occiput, then a frontal shot is strongly implied. And that means conspiracy. However, not everyone believes this. Here are some folks who think it came from the parietal area. Randy Robertson, MD, Joe Riley, J. Lawrence Angel, who worked with the HSCA, Richard Tobias, Pat Spear, and the HSCA claimed it came from the parietal area. This is my reconstruction. This is the back of the skull. Harper fragment in yellow derives from this area. And one reason we know that is because this area of missing bone here has a unique size and shape and location, and we can see that clearly on the AP X-ray. It's been overlooked by people who looked at it. Mike Chesser, my colleague who spoke yesterday and who visited the archives, agrees with me. The other item that's very interesting and curious is that this is what I did. I got a model human skull, not a plastic skull, but a real human skull, and a real Mantik or Carcano bullet. I sliced off a piece. I put that piece on as a human skull, just like the JFK autopsy X-rays. And then I outlined with lead wires exactly where all the bone fragments were on my model skull. And I kept taking pictures, X-ray pictures, until everything matched perfectly. Then I knew where there were holes in the skull. And that's where the Harper fragment fit. And after I did that, not before, but after I did that, I realized, oh my gosh, there's a metallic smear here, just where Humes and Boswell said the bullet entered. I didn't force that to happen. It happened because that's where the bone fit. Here's the anterior posterior or frontal X-ray. And at this site, on the X-ray, we can see that bone is clearly missing right there. It's missing everywhere else too, but it's more obvious to see because it's on the left side in the occiput. The other thing that's critical is that superior to the tips of these green arrows, that is up here, the lambdoid sutures cannot be seen. They can be seen below here, which means the bone is present here and here, but the bone is missing just above this point as well. So the hole that was seen there was not just the lambdoid, it was not just the Harper fragment, but it was also a little additional bone. You all read that? Can you imagine what JFK's would have done? So serendipity struck in the radiology suite. I've already covered this, but that was really quite an emotional shock to me when I realized how that metallic smear ended up just where Hims and Boswell placed it. And if you look at the so-called mystery photo F8, named after Fox, the Secret Service agent, this is where it fits. This black line divides the left skull here from the right skull here. So it's low in the back. It's actually in the upper occiput. F8, the mystery photo, is in the official collection called 1718, 44, and 45. So here's the Harper fragment as photographed in Dallas. This is the exterior, and this is the interior. The metallic smear, which you should be able to see pretty well from your seats, is grayish color here. And notice that it's only on the outside. There's no metallic smear seen on the inside. The red arrows here identify the suture that Lawrence Angel thought he saw, but he was wrong. The yellow arrows identified the suture that I thought I saw initially, but I was wrong too. The green arrow probably identifies the superior sagittal sinus, which is characteristic of this part of the upper occiput. Here we're comparing the photograph with the metallic smear, which you've already seen, to the X-ray, which the FBI took. And you can see, if you look closely, there's metal here, but we can do better. Here's a close-up of that same area on the X-ray. There is metal there. So we have excellent correlation between the metal seen on the photograph correlating well with the metal seen on the X-ray. So it's very likely that was a site of bullet entry. JFK could probably tell you a lot about it like this. And here we have Angel's sketch. This is J. Lawrence Angel for the HSCA. He placed the Harper fragment here. You see, this is the parietal area, the top of the head. This is the wrong location. And he did it because he thought he saw a suture line, the one I just showed you. We'll come back to the triangular fragment here in pink or red in a minute. So there is Angel's suture line, but there's no suture on the inside surface, which is a little odd. It's the first clue that he was wrong. Here's a close-up. This is really just an optical illusion. This pale area is devoid of periosteum, which is the thin film covering the bone, directly overlying the bone, and it's pale because it's missing in this pale area. Here we do have periosteum, so this is just the torn periosteum, which looked to Angel like a suture, and this part over here is just misleading. There's no periosteum issue, there's no suture, it's just an optical illusion. And as I said, I made a mistake too when I was using the Dallas photograph because they're lower resolution. I thought this was the sagittal suture, but it's not. And one of the reasons we know that is because I was able to look at the X-ray of the Harper fragment with a whole range of intensities. While doing that, you should be able to see pretty easily where a suture is, and it never appears. It's never visible on the inside either, so there are no sutures on this fragment. I was wrong, Angel was wrong. Now this is the triangular fragment, also used at the autopsy, and lo and behold, we have metal on this one too. So we have a curious conundrum here. We have metal here on the Harper fragment, and we have metal here on the triangular fragment. And I believe that Angel did locate this triangular fragment correctly toward the anterior skull. In fact, the bone is missing in JFK's forehead at about that location, as I determined by really careful observation of the archives and optical density measurements as well. The John Fitzpatrick, the forensic radiologist consulted by the ARRB, also agreed with that. So we have a strange situation with metal fragments here and metal fragments here. So the question is, did Angel mean to suggest an entry here and an exit here? Does that make any sense? Of course not. I think he forgot to look at the triangular fragment when he was thinking about this. This makes no sense at all. It's wrong. Yes.
Why it makes no sense.
What was that?
Tell them why it makes no sense.
We can spend a little more time on that if you like. Nobody has ever suggested that a bullet entered the top of the head, have they? Not to my knowledge. There's no other corroboration for that. That's just nonsense. So that's the first reason it's wrong. The bullet may have exited from here if it came in at the occiput. That's conceivable. It's hard to argue with that, but it did not come in here and exit here. So the Harper fragment is simply incorrectly placed here. It doesn't fit here. And I, too, have been depressed since 1993 when I got involved in this case. That's the same year. So I want to emphasize that the debris, the metallic smear that you see here, is on the outside. Could that be an exit? No, there's no way. It has to be an entrance. The bullet came in there. It's the only way you can deposit metal on the outside. So that's a really big clue, which nobody seems to pay any attention to. I have no idea why they don't think about that.
Something fell out. That's my saw. That's yours.
So this clearly implies a bullet entry. A parietal site, that's the one that Angel used, implies a bullet entry near the top of the head. That's not the colic area. Nobody's ever suggested that. Parietal supporters never explain how this is possible. Just ask them to explain this to you. It will be an interesting conversation. But if the bullet entered at Hume's external occipital protuberance site, then everything fits. The smear is naturally then on the outside.
Can you point to this site?
Can I point to what?
On your head, can you point to the site where
BOP.
Hume says that?
Well, we're coming to that. There are lots of pictures coming.
Okay, thank you.
I don't want to abuse my head. So this is where the Harper fragment came from. And you can see on this sketch, or drawing, the cerebellum here. So as McClellan was watching, he saw the cerebellum extrude from the big hole back here. You can see how readily he would be able to see that if the brain were traumatized severely, absent here. he would naturally be easily able to see that. So 9 Parkland doctors saw cerebellum, including several neurosurgeons. On the other hand, here's the sketch of the brain prepared by Ida. You can see that there's no damage to the cerebellum. This is not JFK's brain. Can't be. The HSCA could not admit to a traumatized cerebellum, as McClellan and others recall. That's because the brain photo showed an intact cerebellum. They were stuck with that brain photo. So the entry wound absolutely had to be elevated to the red spot on the scalp in the photographs, which we'll see in a bit. And all the witnesses to the posterior hole had to be discredited. Every one of them was wrong. The HSCA had no option here unless they were going to allow conspiracy. Robert Groden has published many pictures, and this is just 4 doctors showing where the hole was in the back of the head. But it's curious that Dr. Randy Robertson does not believe any of these doctors. He thinks that the intact scalp at the back of the head is authentic, that there was no hole there. Same with Joe Riley, same with Pat Spear, same with Don Thomas. John Eversole was the autopsy radiologist, the only radiologist at the autopsy who told me that it was a big hole at the back of the head. He viewed the x-rays, of course, because he was the radiologist, and he knew where the bone was missing on the x-rays. In his mind, there was no conflict between what he saw on JFK's body compared to the x-rays. Everything made sense, and he was right, it does. He told me there was a big hole in the occiput, and he told the HSCA that the wound was occipital. He specifically recalled that a large bone fragment arrived at the autopsy, so he naturally concluded that it must have come from the occiput. So obviously he knew that bone was missing at the back of the head. 5 minutes? 6 minutes? I caution you about going to doctors. I see this every day. You don't see this. So we'll wrap it up with the observations of the 3 Dallas pathologists who actually didn't just see photographs, but actually handled the Harper fragment that day. In 1997, Andy Purdy interviewed Dr. Cairns, the chief pathologist at Methodist Hospital here in Dallas. Cairns recalled that the fragment came from an area approximately 2.5 to 3 inches above the spine. And it had the markings of the skull fragment from the lower occipital area, specifically suture markings, and inner markings were blood vessels run around the base of the skull. He also recalled that the Harper fragment derived from an area close to an entry site. We've already seen that. So here's my reconstruction of what Karen said. The paper cutout is the Harper fragment, placed appropriately in my opinion, and the ruler is measured in inches. So you can see, probably, well maybe you can, that it's 2.5 inches above the base of the skull, just as he said. Here's the lateral view, and the red arrow again identifies the center of the Harper fragment. The yellow arrow identifies the external occipital protuberance, and the green arrow marks the base of the skull. So again, it's 2.5 inches above the bottom of the ruler, just as he said. Well, we'll do 1 or 2 more slides. 1993, as I was getting involved in this case, as I said a bit ago, Mr. Mark Crouch sent me some photographs. He got them from James K. Fox, the Secret Service agent, and here is one of the photographs that he sent me. This is the mystery view of the back of the head. Now, you cannot see this in any publicly available images, but at the archives, this area is critical here, because what you see is abdominal fat pads from the pathologist opening the abdomen with the so-called Y incision. And we can even see a nipple very clearly in stereo views, but it's very hard to see here. Robert Kirshner, the forensic pathologist for the ARRB, said there was a yellow spot in the color photos that was thought to be muscle and fat, which had possibly been exposed by the reflection of the skin pulled back as a result of the Y incision during the autopsy. We agreed. Mike Chesser, my colleague, has also observed the same features. So that's a major clue to what direction we're looking here. We must be looking from the back of the head across JFK's chest where the nipple was, and then farther down across the abdomen. So this has to be looking at the back of the head based on that alone. This will be our last slide. You've already seen this, but this is further, seeing the fat in the abdomen and the nipple is further corroboration for interpreting this as a posterior view. So JFK is lying on his back here. His head is turned slightly to the left, which is why the line here is not straight vertical. So this is the left side, this is the right side. This cyan line was a mistake by Paul Seaton. Doesn't really need to be here. But the smear where the bullet entered, according to Hume's and according to my reconstruction, would have been about right here. We don't really see the external occipital protuberance well here. So I think we'll carry on tomorrow with a few more jokes.